Hello, hello. Welcome, everyone. So happy to have you here. Today, you are joining us for our National Public Health Week event, where we'll get to hear more about the Minneapolis Urban Initiative for Reproductive Health. We're happy to have you here. If you are not already aware, it is National Public Health Week. So happy National Public Health Week. We have some exciting news. So in partnership with the Minnesota Society for Public Health, we worked with them to ask our Governor, Tim Walz, to declare this week, April 3rd through the 9th, 2023 Public Health Week. And he said, okay. So here is our official proclamation here telling more about Public Health Week. It's just we're excited to have this as a declaration, and feel free to check this out at MPHA.net. It's on our homepage if you want to read it. I recognize it's pretty small, but just wanted to say happy National Public Health Week, and it's official. So that's really exciting. All right, so I'm sure this is no one's first Zoom, but just to have a couple things said here, please do mute your microphone when you're not talking. It's up to you if you want your camera on or not. Wherever you're coming from is totally fine. If you feel comfortable, please rename yourself to include your pronouns. And you are more than welcome to put questions and comments in the chat. And lastly, before we get started, something we always do before we have our Minnesota Public Health events happen is we read our ancestral land statement. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors, and descendants, as well as the land itself. All right, so I'm going to stop sharing here so we can get our panelists up and running. Let's see, am I frozen?
No, you're not frozen.
Oh, okay, my screen is frozen, so that is confusing. Let's see, am I still sharing?
Yeah.
Oh my goodness.
Chloe's laptop is from 2016. Everybody.
I have a very old laptop, and I think I just tapped out of everything. Can you unshare for me? Oh my gosh. Okay.
You're not sharing anymore. You're good.
All right, folks. Yeah, I'm due for a new laptop. Anywho, so apologies for that. Welcome everybody for those who are joining us now. Since we have our president who is on our panel, we will have her start. So Ellen and all of our panelists moving forward, please share your name, pronouns, and the organization that you are representing.
Hi, everyone. As Chloe said, I am Ellen Sluris. I am the current president of MPHA. So welcome to this MPHA event. My pronouns are she, her, hers. And I am here as the Director of Maternal and Child Health with WellShare International. And I'm going to pass it off to Trina.
Hello. I am Trina. I live with the Annex Teen Clinic. She, her pronouns. I am the HIV outreach specialist. Welcome, everyone. And I'll pass it to Sarah.
Good afternoon, everyone. Sarah Sheely, she, her pronouns. I'm with the Minneapolis Health Department. And I'll pass it to Erin.
Hi, everyone. Good afternoon. My name is Erin Sicking, she, her pronouns. I also work with Sarah at the Minneapolis Health Department. And I can pass to Myra.
Hi, everyone. My name is Mayra. My pronouns are she, her, ella in Spanish, and I'm working as the program supervisor for the sexual health education program here at CLUS. CLUS stands for Comunidades Latinas Unidas en Servicio, and in English, that is Latin Communities United in Service. Thank you for having me. And I'm passing it on to Gretchen, I believe.
Well, Pat, I think Javi just joined, so we'll pass it to Javi once she connects to us. Just in time, Javi. Would you introduce yourself?
Yes. Hi, my name is Javiera Monardes. My pronouns are she, her. I work for different organizations. The main one is Hennepin Healthcare in a program called Between Us, that is a teen pregnancy and STI prevention program that offers confidential care for teens in the primary care setting.
All right. Is that everybody? Okay, happy to have you all here. Excellent. So just to get us started, the first question I would love for you folks to answer is, what is the state of sexual health for young people in Minnesota, and what has changed?
Yeah, I can start off and folks can chime in if they want. There's a lot that any of us could say about this, because obviously we're passionate about it. I think, you know, if there's one main theme that I would impart about the state of sexual health for young people in Minnesota is that we have really entrenched disparities based on race, ethnicity. There's big disparities that can be seen in rural and more urban areas, certainly for LGBTQ young people that are involved in foster care or the juvenile justice system. We've seen in, you know, the past decade or so, a decrease in the birth rate for young people, for teens. And we've seen for many years the STI rates, so particularly like chlamydia and gonorrhea, increase. And young people disproportionately make up the most STI cases. That's true across the state, but true in Minnesota as well. And we're going to have a colleague of ours, Jill Ferris, who works at the Prevention Research Center, join us, but she wasn't able to make it. Jill knows all of the data. I'm going to put in the chat a link to their report, which shows kind of, it happens every year. You can look at it by counties. And so I'll share that for people to look at and get the information. I think there's still a lot of work to do, and that work needs to be done in partnership with young people and communities, but also with parents. The most recent adolescent sexual health report included a survey that showed that 90% of parents across the state from different communities of different religious backgrounds supported young people getting sex ed in Minnesota. I'll kind of pause there.
Awesome. Does anybody want to add on to that before we move on?
Yes, I would like to add on to the first question, the state of sexual health for young people in Minnesota. What I have seen the most is an increase for sexual health education to be more inclusive. And what I mean by that is like from recognizing different identities, recognizing different sexual orientations, recognizing different cultural backgrounds, recognizing different even languages, and the way that examples are used might not always be as inclusive or resonate with the students, especially with those students that are like first, second generation immigrants, right? As well as those that are just arriving to Minnesota, because we've seen a lot of increase in that too. And so I think something that Minnesota has done really well is like they have a lot of organizations that provide sexual health services, both in school and then out of school. And I think it will be really great to continue on with like the in-school education that is more inclusive for everyone, so that they can feel seen and resonate with the information that is needed for their healthy sexuality.
Wonderful. Thank you. Thank you for those additions. It's really important to note. So thank you. The next question we have is, can you share some of the history of the Minneapolis Urban Initiative?
Yeah, so I'm going to talk about that question. And just we'll start out by letting folks know that the Minneapolis Urban Initiative, or MUI as we typically refer to it as, is actually part of a larger initiative, which is the National Urban Initiative that was originally started back in 2008 by the National Institute for Reproductive Health. That is a national group that is an advocacy organization, and their focus is on fighting for just and equitable access to reproductive health care in states and cities nationwide. So after that sort of national initiative started, Minneapolis started our Minneapolis Urban Initiative in 2009. Back then, it was sort of convened originally by the Minnesota Organization on Adolescent Pregnancy, Prevention, and Parenting, some may know as MOAP, which then became TeenWise. Sadly, TeenWise closed their doors back in 2015, and then the Minneapolis Health Department sort of became the primary convener of MUI at that time, and has been since then. Historically, MUI has been made up of partners from Hennepin County, the Minnesota Department of Health, Minneapolis Public Schools, and then a large number of community-based organizations that provide sexual health services and education for young people. Sort of the first initial focus of MUI was largely looking at changing policy within Minneapolis Public Schools to support training and development for teachers on sexual health education, and trying to implement a sexual health curriculum within the middle schools, and also working with MPS, Minneapolis Public Schools, to affirm that sexual health curriculum were science-based. So just some highlights from over the years. In 2010, MUI, this was before my time as being part of MUI. I see our former commissioner, health commissioner Gretchen Musicant was here and was certainly instrumental in a lot of this work. But in 2010, the group worked to get MPS to implement the curricula Making Proud Choices at all middle schools. And then in 2015, the 2015-16 school year, middle schools at MPS finally began to require sexual health education in all the schools, ensuring that every 7th and 8th grader received at least 1/4 of Making Proud Choices each year during their health class. Since then, there has been a little bit of a hiatus in the group meeting, but back sort of in 2010, MUI started meeting again, convened by the Minneapolis Health Department, and sort of one of the driving forces behind that, some of you all remember, maybe there was a lot of federal funding cuts to a lot of different grant dollars and federal agencies that supported this work. And back, sort of when the Trump administration was beginning, there was some attacks and threats that were being made. So the group really wanted to come back together to continue to support the work. And then, as Ellen sort of mentioned at that time, the group really started to focus their shift based on seeing a decrease in teen pregnancy rates, and also looking at the increase in STI rates among young people, and also the disparity where we're seeing much higher rates of STIs in youth of color. And so that was sort of where the group started its focus. And over the years, the group continued to do a number of smaller projects focusing on, again, supporting teachers with continued education, as well as working with youth workers that work with young people and attempting to help them with gaining more knowledge around being able to speak with young people about sexuality. And then after many different iterations and finding the right group, we sort of found a good focus area, and that's where I'm going to sort of stop talking, because I know the next question is going to talk about what the group's been up to over the last few years. So thank you.
That's an excellent segue. So what has the group been up to the past few years? Let us know. Tell us all about it.
I can talk a bit about that. So I joined the group when I think it was 2017, and we started planning. We were trying to let people know what we were doing, right? Like who we were, why these organizations got together, and kind of expand a little. And it took us a while. I remember getting together in the Annex Clinic. We were just kind of brainstorming, and we were thinking maybe we could I don't know, like ask people to tell their stories and how sexual health has, or the sexual services that they have received has changed their life, right? And we had many. That's the thing. If we talk to the people, if we talk to the community, we have a lot of good stories and success stories. And also, I would say was one of the things that we wanted to show is how many people would have benefited from the services if they would have had it earlier. And we're so happy to say that we do have it now. We do have many services that are actually changing people's lives, and we wanted to show it to everyone. So we ended up coming up with this idea of having a storytelling project. We were going to have people from different areas of the city talk about and different backgrounds, talk about their experiences, and everything was ready to go. Even though we were all volunteering, like all the people that works in this group, of course, we represent our jobs, our like organizations, but this is extra. Like we were just kind of contributing this time. And that's why it took longer than we thought, because we didn't have any time allocated for this. So in 2020, March 2020, we were ready to record March 16, actually. And we couldn't. Everything shut down. I remember calling to one of the mothers that was going to be one of the persons that we were going to record, telling her like, nope, I think we will have to wait a little, like until this stops. It didn't for like a year or 2 or 3. So in 2022, after the pandemic and after we kind of got to go back to something more than COVID, because that's the thing. We were with the team, we were talking about this and we were like, this is so sad because COVID is important, of course, but sexual health is still a thing. We even wanted to create like a hashtag saying like, sexual health is still happening. We talked about making like analogies between using a condom and using a mask, just kind of trying to bring the whole sexual health to people's mind, because that was something that was happening too, right? And in 2022, the city of Minneapolis had some funds that they could use for something related to sexual health, and we came back to thinking in our project. We're like, this is the perfect time to do our campaign. Maybe we will have to reframe it a little. Since we had some money, we hired a company that could help us with all the marketing stuff, creating like a real video. I don't know, just making it more professional. And it was very exciting to see that all these ideas that we started elaborating some time ago came to be something real. And now we have this video that we're going to show you. It's a great video. I mean, I like it, but it's a video that kind of summarizes what our goal is as MUI. And we just want everyone to know that MUI is this group of people, a group of organizations that want to be there for to provide all the resources and everything a teenager or a family needs to have healthy sexual health. That's the idea. And hopefully we become this hub of for everyone to go and know what's happening with sexual health in the cities. That is a lot, actually.
All right, fingers crossed that my internet has been going in and out today. But here is our video.
The sex education I received growing up, well, pretty much non-existent. Minimal, fear-based. There were a lot of things that were unsaid.
We can do better.
We are the Minneapolis
Urban Initiative.
Today's sex ed needs to be inclusive,
Diverse,
funded,
evidence-based, empowering,
culturally specific,
evolving.
free of judgment and shame.
The fact is, sex education works.
Over the last 10 years, we've seen teen pregnancy rates on the decline. That's directly related to access to sex education and increased access to contraception. But our work here is not done. Rates of sexually transmitted infections are as high as they've ever been. We still have a lot of work to do.
Fortunately, we can ensure that teens get the help they need to make the best decisions.
Did you know that all Minneapolis public high schools have clinics where students can access confidential care and sexual health resources at no cost?
Our mission is to prepare teens and equip their caregivers with the knowledge, the skills, and the confidence to grow into happy and healthy adults.
Our organizations provide confidential reproductive care, including sexual health education for parents, teachers, and teens, STI testing and treatment, and access to birth control and safer sex protection like condoms. The future of sex ed is in our hands.
My hope is that it's inclusive of all genders, sexualities, races, ethnicities, and abilities.
That this becomes as regular as math class.
That it's treated as an essential part of our healthcare.
That this next generation is able to navigate their sexual lives in a responsible, respectful, and safe way. That's our job. That's our goal.
We belong
to the Minneapolis Urban
Initiative.
Together, we can ensure a better,
Stronger,
and safer tomorrow.
You can share your applause emojis. Thank you. I love the video too. No pressure, but we do like emojis.
That really was a wonderful video. Thank you for sharing that, Ellen. I appreciate that. So another question for the group. What does it take for a group like this to sustain? What lessons did you learn with this project?
Yeah, I think Javi shared some of them. I mean, certainly everything that happened in 2020 with the pandemic, but in general, just like everyone has lives. Like I was on parenting leave for months, so I was out. Just, I think a willingness and openness to accept where people are at and remain committed to what we're doing and just like open to ideas and space. And I think for me, that's one of the lessons I've learned. I think also we know how to do a lot of things, but like we're not like marketing professionals or people who make websites. So figuring out how to be like scrappy and make it work so that we have like a product that represents, I think, like the quality of the work that everyone that's supporting young people is doing.
I agree with Ellen, Javi. This was a long time coming and just staying committed. And like they said, there was no time allocated for this. So we had to make this work around our lives, our regular jobs, and still be committed to come back even after the pandemic, even way before the pandemic. Like Aaron said, this was started years ago, and we come, we leave, we come, and now here we are. We finally have something to show what we've been working on all these years. So
if I may add, to Ellen's point and Trina's point, I think everybody's common denominator is the pandemic and the quarantine. And this is me speaking as a medical case manager. Now, I know some of you have specifically worked with children, but I work with adults. But this same concept, adolescents, children, adults, old, elderly, what have you. During the quarantine, people just lost touch of everything. When people in the community was hearing that this organization's closed for right now, this organization's closed, where were people going? This is why we had 2 HIV outbreaks within the last 3 years. And I got both emails to prove it. So it's like when you don't have no support during that quarantine and COVID-19 period, where were people going to? Where were people going for sexual education and sexually protective barriers? There were nowhere to go for a long time. So to answer your question, Chloe, which I love your name, by the way, to sustain a initiative like this, we're gonna have to stay adaptive and we gotta stay present. Even if we do fall into another quarantine period, we gotta be adaptive to that. Since we've already been through 2020, if another quarantine period comes up in 2023, everybody on this call who has the passion and the drive for this work, we gotta be adaptive to be able to reach out. Because children more than adults, particularly. I yield the floor.
Thank you, DeAndre.
Thank you, DeAndre.
If you all don't know DeAndre works at the African American AIDS Task Force and is wonderful.
I agree with everything that's been said. I think what's made it special about our group and our process is that it really is a collective and we really are working collaboratively. You know, it's not about one organization versus another. It's how can we all work together to support youth in Minneapolis. And so that's been a real consistent throughout this process. And just being flexible and open to all the different ideas. Sometimes it got, you know, when you've got a ton of ideas, it can be sometimes a little unruly, but, and because of what we were all going through, there is like, it was kind of like, well, maybe we should focus on this, or maybe we should change our messaging to that as we're trying to move this forward. But, you know, just really being open to that, I think.
Yeah, absolutely. Thank you all for your contributions to that. I think that was a really good holistic answer. So thank you. So we've talked about some lessons. We've talked about what you're up to. What are the next steps? Let's think about the future here. What are the next steps with MUI?
It's we've been so focused on this for so long. Just so you all know, we officially kicked off kind of this social media campaign. So I think I just got an email that the video was posted, and so all the partner organizations are going to reshare it out. We're going to spend this month posting from each of our organizations. It's STI Awareness Month, so that's part of why we chose this month to really kind of get the messaging out and raise awareness. We will continue to work together to raise awareness, especially among policymakers and decision makers, about the importance of comprehensive sex ed and services for young people. We want to continue to support advocacy efforts for comprehensive sex ed in schools. And kind of, I think the very next thing that we're discussing is STI testing week, and kind of having that done together as a collective. So those are some of the next things. I think now that we have a website, and we've got a little bit more structure and we're kind of raising awareness, I think we'll do some more planning about what's next and hope to engage other youth, sexual and reproductive health serving organizations in Minneapolis or beyond, to just, you know, work with us on this. So
We have like 15 things that we want our web developer, who is my partner, that I got roped into helping us with this. We have like so many things that we want him to do on the website. We've been told things take time. Javi has a lot of website ideas.
Are you gonna try to say something, Javi? Okay.
There we go. Yeah, I
Okay.
was gonna say that I think it's just I get so excited with all the things that we could do that I want to do them all right away. And of course it takes time. And I think it's just great to have a team to do it. It's great to have a person that is helping us. And I mean, I work a lot with students and interns that are from different areas, not only public health. And I know there is a lot of interest in the new generations, right? To make this a better, I mean, to have resources for people to know what's happening about sexual health in the cities, to maybe create content. So I think there are so many things we can do now that we have a website, and just having the collaborative together, all these organizations that bring great ideas, bring great resources, is just only good things. I mean, what else, what bad thing could come up from this, right?
That optimism is infectious. That's great to hear. Oh, go ahead, Sarah. Sorry, go ahead.
We probably should start looking at how we can get some money somewhere too. We really, we don't have a budget, which is fine. We've done a lot, but just keeping our eyes open on that too. So
Money does make the world go round, especially in these contexts. So I hope you all get the funding you need, and I hope that's great. Speaking of funding, maybe in our audience, folks have ideas. So what can people in the audience do to support young people's sexual and reproductive health, and maybe this initiative as well?
Like Sarah said, like you said, funding, that's to me, well, we all know that plays a huge part in this. We need, funding to sustain, to keep it moving, to keep it going, because that would help expand things, and get the word out more, get what these young people really, really need right now.
And if I can add to that too, I would just say advocacy. The work that when we first started talking about this storytelling project, a lot of it was discussing about how can we get to advocate to our all of our elected officials that it's important to try to support comprehensive sex ed in all schools, and at a younger age and throughout the career, like said in the video, that it's hopefully as important as math, or it's as normal as a math class. So just supporting and advocating for comprehensive sex ed at a policy level is also, really important, I think.
I often would tell people, so I used to teach like peer workshops, do a lot of training for youth workers and professionals, and I would tell everyone, like, everybody, whether they know it or not, like, is a sexuality educator by virtue of like being in community with other people, with young people, right? Interacting and talking about, what we're seeing in TV or in music, right? Like all of those are opportunities for us all to like process and think about, ourselves, our values, our health, but also our community and what sexual health means, what body image, autonomy, like healthy relationships, what all of those things mean for all of us. And so, I'm really fortunate to know from my work that there are so many wonderful like professionals here that do trainings to support people understanding, their values, but also just practice. How do you start a conversation with, a young person in your life? How do you as a parent even figure out what you want to say, and how to say it? How do you help people access resources? I think, regardless of who we are, and obviously I'm biased as a sexuality educator, like regardless of who we are, we all have, the opportunity to be part of a network of support for young people and for each other. So that's what I would say, I guess.
I agree with you, Ellen. And then start having these conversations with these young people. Don't be afraid to pull them to the side and have a conversation with our young people. What I'm seeing is that we are so caught up in what's really going on, even though the pandemic hit and all of that, but a lot of people shied away from these young people, what they need, and they got off the chain during the pandemic. The annex, we still were open, but our doors were locked. I was able to go in the parking lot and do mouth swabs for HIV. We were able to go out there and deliver Plan Bs, whatever they really much needed. They just couldn't come in the building. But now the pandemic, I think, opened us up. We struggled, but we're further than we were before. So now we got some ideas, and now we're all working together to come together to make this work for our young people, to tear down those barriers and to give them what they need. Have these conversations. The problem, what I'm seeing is we're not talking to them. We're talking at them. We're not talking to them. We're not sitting down having a healthy conversation. What's going on with you today? How was your day? All of that. That's what they're missing. We got to take it back to the old time. Everybody's caught up in the social media. Oh, go look it up. Go Google. No, I want you to talk to me. I'm a talker. Everybody know the computer's not my thing. That's not my friend. But I will sure have a conversation face to face with you to help you get what you need and meet you where you at. That's what we're all about.
Yeah, Trina and I would go and do, chlamydia, gonorrhea, and HIV screenings. And I remember one time Trina, because Trina she'll go around, she'll talk to young people, and one time you were like, well, if, maybe they don't come and get tested this time, but they know that I am Trina from the annex and they can come to me when they, want to get tested or they want information. So knowing that, like, even if something doesn't happen, like right then, there is that knowledge. Yeah.
I would like to echo that, because sometimes, like Trina was saying, we talk at them and that just doesn't build any sort of trust. So when they are going through something, like, they're not going to come to us. And that doesn't help anyone, especially our young people. I think another concept of like being a trusted adult is understanding that maybe without intending to, you could be someone's trusted adult that maybe it's like your kid's friends or your little cousins or another family member, because they're like, oh my God, they're so cool, right? And so understanding that, like, maybe you didn't sign up for it, but you could definitely be that person of trust, like, to send those messages of like, you deserve to be in a healthy relationship. Like, it's okay to get an STI test. Like, oh my God, it happens to everyone, right? Like, it's okay to seek out these services. Like, do you need help? Like, we can go together or something. I think it's really important to recognize that maybe in our personal lives, we might not interact, right? But we could definitely be that like small trusted person for someone that maybe we don't see so often.
Yeah, and I want to add that this collaborative is so great because we're kind of on the same page. We all want to do the same thing. Like we have the same mission here. We see everyone getting all the resources they need to become the best sexual health educator, but also to receive the best resources. And I want to bring parents to the table, because sometimes parents feel that we're kind of taking in our hands the educations of their children for sexual health and stuff. And actually it's the opposite. We want them to be the first educators. And I think all our organizations have been trained in a curriculum that is a Minnesotan curriculum that's called It's That Easy. And the base of that is the parents should be the first sexuality educators of their children. And what we want to do is give them the tools. And we want to be there in case they want to talk about something else. Sometimes you love your parents, you trust your parents, but you want to talk about certain things. You don't want to tell your parent that you might think your boyfriend is cheating on you, right? But we want to be there in that case. We are those people that they can trust us. And my job is also train providers. So providers can be those adults, nurses, MAs, like anyone that's in the clinic in primary care setting, right? And hopefully this expands to all the primary care settings in the cities. Hopefully everyone can have access to a trusted adult when they need it.
Wonderful.
I
Go ahead.
just wanted to piggyback off of what the previous two had said. I just want to put huge emphasis on the word trusted. Because everybody that's out talking to these young adolescents are not trusted individuals. You can't just consider yourself a trusted person and just telling young people whatever. You got to be able to, whatever questions because questions are gonna come up, especially with the young people. You got to be a trusted person that can tell this young person or try to answer their question to the best of your ability. I know I don't know is kind of annoying, but it's best to say I don't know if you don't know. You know what I'm saying? We can't be just projecting whatever information to these young people. They're going to take your information, they're going to run with it. And just like the one before me has said, we're not trying to be the parent. So it should start at the house with the parents first. And if there are any additional questions in this realm, they should be able to come to a trusted individual, which it seems like everybody on this call are trusted people. But you can't tell them one thing and then you go out and do another,
That's an excellent point. Thank you for that. Absolutely. Gretchen, I see your hands raised. Do you want to go ahead and unmute and ask your question?
Sure, I'm gonna act as a historian. So Aaron mentioned that I'd been around at the beginning of the formation of the MUI, and we were invited out to a big meeting in New York City to talk about this, and they had quite a robust fundraising machine out there, and so they had money to actually give to other localities around the country, and asked us to think about what additional could be done. And I think everyone that came to that meeting was as busy and as involved as all the speakers here in the day-to-day work, in the working with young people. We already had our school-based clinics. We thought we were doing a great job, but when you looked at the statistics, just as we saw in the video, we've made good progress with teen parenting, but the STIs are still, insurmountable perhaps. And I guess that was the big challenge, is what's new, what's missing? How can we do all the wonderful things we are doing? And what is that other something? And so that's when we came back to Minneapolis, talked to the people at the school-based clinics. They said, we're in the high schools, but we're getting kids from middle school that really don't know anything, and we're starting from scratch. And so that was the idea, was to get some curriculum going in the middle school. And as you heard, that, took a lot of work, but, good progress has been made. And so I'm just wondering, easy for me to come up with ideas or think about ideas. I'm an idea person, but if the group feels it can challenge itself in that same way, to not only talk about how can we do what we're doing a little bit better, but what is a missing piece on top of all of our doing, that this collaborative could help advance. So just a little history and a little challenge.
I'll say what immediately comes to mind to me, and maybe is outside of the Minneapolis Urban Initiative. I grew up in St. Cloud, and so I often think about, like, how can we build connections and supports around the state? And to me, for many years, now, working at WellShare, we have an office in Mankato. I see my colleague Maria's here, but at the annex and everywhere, just like, how do we build more relationships and then have the energy to support those ideas? That's one thing to me that I think about, and I realize it's the Minneapolis Urban Initiative, but that's one thing that has felt like a challenge to me, especially thinking about how few, solely sexual reproductive health clinics there are in rural counties in Minnesota, and all the challenges that young people face, even when there are clinics, blocks away from their homes. That's one thing that comes to me. I think advocacy in itself and, all of that, talking to people and following up with people and planning for things related to policy is a tremendous amount of work. And since this is something that's kind of a plus to our normal roles, I think that would be a challenge, but a worthwhile one.
I think we're still missing some resources for different communities inside Minneapolis. I know the Hmong community, the Somali community don't have they don't have any resources compared to all the resources we have. Even the Latino community has more resources, but I think the Somali community and the Hmong community, we have seen actually that the STI rates are increasing in those communities, and it's very hard to go in them, and that's why we need people from those communities involved in this work. We cannot just go and teach them. I mean, as we all know, even though I speak English, I don't feel as comfortable talking to Americans as I feel with Latinos, right? And I think it's the same for anyone from other communities. So I think just getting people involved in this work so they can go back to their communities and provide them with resources, find a way to talk to those parents. I think that's still missing.
I feel like I'm talking too much, but this is very, very great dialogue. When it comes to this dialogue, I'm all here. I'm present and accounted for. But I understand, and this is just to add to Gretchen's point too, because I think she's challenging everybody on this call. I don't think everybody has the same approach like me. More real life experiences being taught to young people. Like, for example, if you are teaching a sexual health session and then you just speak a vignette about your personal experience to them, that will probably be more eye-opening to them, because a lot of us sexual health professionals, we don't like to go into a setting, especially in a setting with adolescents, and talk about our real life experiences when it comes to intercourse and sexual health. They try to shy away from that just to try to be quote unquote politically correct. And additionally, and this is just a question to people because I don't know, how is legislation with sexual education in middle schools? Because I just heard Gretchen's point about middle school children don't know anything, yet they're the highest population that's sexually active right now in 2023. So they're going into high school with this attitude of, oh, well, I know better, so I'm going to do better, when you really don't, because you were literally an 8th grader just last year. So you don't really know much. So certain states in this country, they shy away from sexual health education, period, in schools, yet alone sexual health education in middle schools, because some legislation feels like that's too young, when everybody on this call knows better.
You're right, DeAndre. You're right. You're right. I'm gonna give it to you. You hit it. And
right.
The last thing I heard, and I don't know, Ellen could jump on, since Making Proud Choices left, has there been anything for middle schoolers?
Yeah, they've continued to implement evidence-based sexuality education in the middle schools in Minneapolis. I think, to speak to your point, DeAndre, there's been efforts, probably for longer than I know, to update and strengthen the state policy around sex ed, because right now it's not tremendously strong in terms of what content needs to be covered and the amount of content that people receive. So I think that leaves open, in my understanding of the issue, leaves open the door for people to be making decisions to not share that information with young people. And so, you know, I've been part of districts like health curriculum reviews where we were working to put fact-based sex ed into like 4th and 5th grade. And so I think there's processes that a lot of people go into, but I think the structure coming down from the state is open. I guess if anyone else knows more or wants to add, please do.
All right. So, oh, go ahead, Erin. I was holding
Okay,
up the sentence for
sorry.
too long.
I don't know. I will be honest that I sort of lost track of what's been going on with the ComSex Ed at the legislative level, and I think that's definitely could be a good thing for MUI to revisit. I know there's other groups that also work on that, including some of our partners within MUI. So I was just gonna say, like, just anecdotally, you know, Sarah and I were having conversations with Jill Ferris from Prevention Research Center, who told us that she started teaching a community ed class at her child's elementary school, after school, doing sex ed. And, you know, she sort of taken a couple different curriculums to make it age appropriate, but had really good success with that, and had a lot of parents who want their kids to get access to that at a younger age, and, you know, to help sort of normalize this conversation at a younger age as well. So that's something we've been in talks with as well, like how could we maybe look at other approaches through a program like community ed to sort of increase access. Well, that doesn't work for everyone, because it wouldn't be required. It's still, you know, a little bit of a starting point or a new idea we've been thinking about.
Well, thank you for that question, DeAndre, and for that question, Gretchen. I think you've given us all lots to think about. If there are other questions, I have several. I could talk to you all for days. This is my favorite topic. So I guess if there's nothing else, I'll ask one question. I'll have some more thoughts, and then we'll close up for the day. I like to ask this question because I'm a very optimistic person. I'm just wondering, you know, if money was no object, if there are no constraints, what would be your big dreams for MUI? What's your biggest dream?
For me, I would say to keep making these videos and steady bringing awareness, having these kind of events, these panels, to keep it moving, to keep it going, would be for me.
I guess when I think about it, kind of, you know, continuing to grow and like maybe becoming like its own still collaborative, like, but a nonprofit with like paid staff, you know, because MOAP and TeenWise did so much for all of us in bringing us together and training and providing that structure and data. And I think that's something that many of us have missed. And then we can give them mini grants to group like youth leaders to do their own projects, because money is no thing. And we could have our own like awesome garden.
I think in addition to all of that, it would be great to make everyone comfortable with talking about sex and sexuality and healthy relationships and everything that takes for someone to have a healthy sexuality. I know that can be done with money. I know that can also be done with like storytelling, which is, I think it looks like that's the way that the trajectory that MUI is going towards. And I really love that because like DeAndre said, most people just resonate with personal, right? And being vulnerable can be very impactful, especially in this work.
I think, and this is no pressure for Matthias, Ellen, for our web developer, but I would love to have a website that is amazing so people can actually get all the resources they need in one place. And for example, I just think, I don't know which curriculum is being used in middle schools. Just go there and find the answer. I would like to know which curriculum they are using in, I don't know, in St. Paul now. Okay, there's a link to get their information. So a place that you can get all that information for us as organizations, but also for people. Like, I would like to see, I don't know, to have a puberty workshop. I can go to the website and see where it's happening, right? I would love that. That's kind of one short-term goal, and I think it's doable. And something else is, I hope that in, like, I don't know, 2 or 3 years, if you say, I have an MUI meeting, they will be like, yeah, the sexual health things. How is that going? Like, everyone knows what MUI is. I would love that, because that would mean that we reached everyone. Also having a social media platform that we have like many followers, so we can just post something there and 10,000 people know or more. Yeah, those are my dreams.
Javi, I think by next week, we're gonna be real popular. So we don't have to wait for 2-3 years. By next week, we're gonna be real popular.
I hope so. Then it pushes us to do more work. And I think that's why I like followers, because then you're like, I need to do something, because they're waiting for it. So that's great.
Sarah or Aaron, do you have any quick closing thoughts before we finish up?
Yeah, I'll go ahead. I would hope that there could be more MUIs like across the state and across the country, to obviously do the work that we're doing, but also for, I think, the support we get from our colleagues and from others doing this work, because sometimes it can be really like hard and depressing and sad. So just kind of that lifting each other up when things are rough, COVID's a perfect example. We knew there were so many young people out there that couldn't get their birth control pills or couldn't, get in for an STI test. And so really kind of trying to work through that together, but also support each other. And I would also love a ton of money to be able to like really engage youth and be able to pay them and provide incentives and so pass it off to Aaron.
Take it away, Aaron.
Yeah, no, Sarah, I think you said it well and brought up a really good point of like bringing in youth, like having more youth voice into their project is really important, and having like, sort of a group of folks that we can sort of turn this work over to as we are aging out of it. So, and I again, like, I just appreciate the support of this group, because doing this work can be challenging for as many people that are out there that support comprehensive sex ed. There's a lot of folks that don't. And so it's important to have these collaboratives together to really like keep fighting the fight when things can be challenging. So.
Excellent. Well said. Well, folks, we have 1 minute left. I apologize for getting us out late. Hopefully my computer is going to be able to show you and allowing. So just really quick, if you enjoyed this, you enjoyed MPHA, become a member if you're not already a member. We support these kinds of works to bringing people together. Can you all see my screen right now or no? Nope.
Just as loading.
Okay, there we go.
Oh, you're good.
Cool, awesome. Also, we have our conference coming up. If you like these kinds of conversations, you like to get in the room with change makers and community leaders, join our conference. The theme is Raising the Public's Health, Becoming a Better Ancestors Through History, Hope, and Action, May 22nd through the 23rd at Concordia Moorhead. There is a virtual component. We have a policy forum series. We're going to be focusing in May on the move, so things like sidewalks and transportation and things like that. How can we prevent injuries? You can register both those at mpha.net. Otherwise, continue enjoying Public Health Week. Check out American Public Health Association's events at this website here. please follow us on all of our social media. We'd love to have you join us and help, support these kinds of initiatives. And we have some of our policy meetings or our different committee meetings over here if you'd like to check it out. But other than that, thank you all for being here. Thank you so much to our panelists for being here and sharing your knowledge and your passions. It's infectious, and I just really appreciate your time. And thanks all for being here. Have a good rest of your day. Enjoy Public Health Week. Take care.
Thanks, everyone.
Thank
Bye.
you.
Thank you.
Thank
Thank you.
Great day, everyone.